So the menopause transition for women can be dramatic. And menopause has a very clear definition. It's 12 months without a menstrual cycle.
Typically, menopause itself is around age 51, 52 on average.
It's when our ovaries stop producing the female hormones, stop producing estrogen, stop producing testosterone, progesterone. When women come to see us, what they're saying is that they're foggy. They're not remembering as well as they used to. Their mood has changed. Sometimes they're depressed, sometimes they're anxious.
Fire and brimstone. I had a patient call it fire and brimstone moments, which is the hot flashes.
Estrogen is the master regulator hormone.
Estrogens literally pushes neurons to burn glucose to make energy. So if your estrogen is high, if your estradiol is high, your brain energy is high.
And as our estrogen levels drop, the brain really feels it.
Less feedback of estrogen coming into the hippocampus means that you have less protection of your hippocampus. So women are lucky throughout their lives that estrogen will protect those cells in the hippocampus. Estrogen actually supports cell health and it prevents cell death. And now, suddenly, a system that's been accustomed to that protection doesn't have as much of it anymore.
We know that women get diagnosed with Alzheimer's disease at double the rate of men. We need to look not when the brain has become atrophied and is starting to shrink, but we need to look in a woman's 30s and her 40s and her 50s to see what can we do? What are the levers that we can pull to reduce her risk of Alzheimer's disease?
We could be looking at menopause as a potential risk factor for cognitive decline down the road. Even though most women do see kind of a rebound in their memory after menopause, there may be some women who don't respond as well after menopause is over and their hippocampus doesn't have that support from estrogen anymore.
Your reproductive life plays a big role in the way the brain is aging. There are new studies showing how women with a shorter reproductive lifespan, so those who perhaps go through puberty a little bit later on in life and go through menopause earlier, seem to have a higher risk of dementia later on in life. For menopausal women, a logical question is, should we take hormones, right? And the idea is that replacing the hormones that the body no longer makes could hopefully alleviate a number of symptoms, like hopefully reduce the risk of dementia.
What it does is it fills those estrogen receptors. Yeah, it prevents premature aging for a woman. It's been found to be beneficial in the risk reduction and prevention of cognitive decline.
Hormonal therapy is really controversial. It's very complex.
We certainly know anyone that has any strong family history of breast cancer. We often do not recommend them going on hormone replacement therapy.
What we do know is that hormone replacement therapy is very important, especially for women who undergo early menopause.
There are studies with hundreds of thousands of women showing that the more fish and legumes you have in your diet, the later on in life you go through menopause. So that's a sort of index of ovarian health and how long you're fertile, which we know correlates with a reduced risk of Alzheimer's in women.
Eat a nutritious diet. A diet along the lines of something like the Mediterranean diet that we know is best for brain health as we age. Things like olive oil instead of butter, lots of vegetables.
The alcohol, keep it to a minimum. If you smoke, quit.
We know that women's brains need more sleep and perhaps more stress reduction techniques than men's brains do, because our hormones, especially estrogen levels, are really sensitive to cortisol. So really, reducing stress doesn't just save your day, it also saves your brain.
You know, the truth about menopause is no one looks forward to it. I think that it can be the best years, the best chapter of a woman's life, honestly. Because even though hormonally things are changing and you're not getting a period, I think you're almost the best version of yourself in your 40s and 50s. You really know what you want.
There's a lot of wisdom. There's a lot of freedom. There's so much more on the other side of menopause.